cat scratch fever in this book from 1982, where it's basically said that it's not completely known what it is. But here said what they say. They say that it can happen after a cat had scratched someone or a fawn had scratched someone, and then after some time their blisters with pus develop, and maybe after 2 weeks or something also is there then pain and swelling, and maybe even a rash at the hand and feet, and maybe even headache and slightly increase of temperature chills and a general feeling of ill health. And then it's said that the person should consult the doctor if there is such a blister with pus filled or something, and then a normal doctor is then said here cannot really diagnose it, so it's then referred to hospital where is taken a piece of it and then looked under a microscope on it. That must be biopsy, and they don't know what it is here written, and it could be a virus is their idea what it might be. It can be a bit more serious. Then the lymph glands which are draining it can become inflamed as well, and they can even form an abscess. Then they might be drained also. And the recovery, if the lymph glands with abscesses were covered, then a longer time of convalescence, so a period of recovery, convale. A period of recovery can be necessary, but we're saying generally after 4 weeks it clears spontaneously up. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 110, written in the year 1982. But this is no substitute for medical knowledge and also no medical advice. And the positions and views expressed are the ones of the source and don't necessarily align with my own or the ones of the entities spoken of. Hi and welcome. I'm trying to learn medicine. Today, cat scratch fever. And after I've done it, we're gonna do hip training. And if you participate in the hip training, then it's at your own risk. And I'm just trying to read and to understand it, so this is no medical advice. Cat scratch fever. It is a rare disease affecting all the systems of the body. It may follow superficial damage to the skin from a cat bite or a scratch from a cat or a fawn. It could be that you read it already once, but so I think I said there already, is it now coming from the cat or from the scratch? Symptoms. A few days after the scratch, a small blister containing pus develops on the site of the injury. A few days afterwards, a small blister with pus develops at the site of the injury. Between 2 to 6 weeks after the injury, the site becomes painful and swollen. 2 to 6 weeks later, painful and swollen the injury site. Lymph glands that drain the site of the injury may become inflamed and swollen with pus, sometimes with serious abscesses. Are there specific lymph glands for specific places of the skin of the body? And the lymph glands which are draining the site, I'm just going to quote them, can also become inflamed and swollen with pus, maybe even to a serious abscess. There may be a slight increase in temperature with headaches, chills, tightness, and a general feeling of ill health. Maybe increased temperature, slight increased temperature, headaches, chills, tightness, and a general feeling of ill health. Sometimes a rash appears on the hands and feet, and maybe a rash on hands and feet. Duration. The disease can last from 2 weeks to several months. If serious abscesses develop in the lymph glands, a long period of convalescence may be necessary. Convalescence, we have to look it up. I'm going to get a big dictionary. Convalescent, recovering health and strength after sickness or debility. Let's study convalescence, convalesco, I grow stronger, convalesco, convale, con and valesco, I get strength, valeo, I am strong, valid aveo, the gradual recovery of health and strength after disease, the state of a person renewing his vigor after sickness or weakness, convalescence, to grow better after sickness, to recover health, convalescence, recovering health and strength after sickness or debility. One who is recovering his health after sickness, convalescently, in a convalescent manner. Okay. If serious abscesses develop in the lymph glands, a long period of convalescence may be necessary. Long period of convalescence may be necessary. So a long time to recover. Causes. The exact cause of cat scratch fever is unknown, but it may be a virus. Okay, in the book from the 80s, in this book from 1982, it is said that it is unknown, but it could be a virus. But a suspicion is, but there is included the chance, but there is not excluded. There is named the possibility of it being a virus. Follow normal home treatment for a fever. Rest in bed, a light diet, and large quantities of fluid. If a pus-filled blister develops on the site of the injury and becomes painful and swollen, contact the doctor if there is a pus-filled blister at the injury site. Has it to become additionally painful and swollen? Let's try to mention some more. And if there's a pus-filled blister developing and pain and let's try to formulate with a semicolon. Developing and pain and discomfort, pain and swelling, contact the doctor. What the doctor might do, as cat scratch fever is not a condition that can normally be diagnosed by a family doctor, he or she will send the patient to hospital for tests. Okay? And here is said that a normal doctor, whatever that now is, exactly now what departure is now a doctor and what is now a hospital and what is what, is maybe referring to a hospital because it can't be either diagnosed. It can't normal. And normal, yeah, but how could we know that it is cat scratch fever which can't be diagnosed without having it not diagnosed? Normally, a normal doctor cannot diagnose it, so there is then a referment to hospitals for further checks made. At the hospital, for tests made. At the hospital, the doctor may take a sample of tissue from the blister for examination under microscope in the laboratory, so probably a biopsy. And when there's a sample from a tissue taken to look under the microscope, it may become necessary to drain any abscesses that form in the lymph glands. Maybe draining abscesses in the lymph glands. Outlook. Cat scratch fever usually clears up spontaneously within 4 weeks. What are these things which spontaneously clear up? The answer has to lie in cytology, has to lie in the cells. That these cells, for some reason, maybe they can live just one life cycle in humans. So they all of a sudden then all die. So they're coming in. So let's just speculate here. We are coming in. They can get one generation. They're living then for 4 weeks. And then they all die because they're not able for a second season, for a second life cycle, for a second whatever generation. And why are not all people the same length? Different types, different amount of. Okay, just a little example, just to speculate. In osteology, so the science of the bones, there was said that from the mesenchyma, the osteogenic cells are coming from the osteogenic cells for cell division, the osteoblasts, out of which then the osteocytes develop. These osteocytes can live up to 25 years or something. What if it has a different length by different people, because it's not one stage? So let's assume it can live only one stage. So the first thing is, it doesn't have to be one stage or one generation. As I just said, with the mesenchyma, to osteogenic cells, to osteoblasts, to osteocytes. These are multiple stages. So it could be that that thing has multiple stages, living longer. What if sometimes the cat scratch fever virus is attacked by the human body and less cells are there? So it goes at different rates, and it has different amounts of splitting, of pairing, of what is called division, cell division. That is then the reason why it is by some people longer or shorter. Because it's specific stadiums in its 2 or 3 stages life cycle, there was an intervening of human body cells to destroy it. And that there were different amounts of them, or something. So the idea is basically, what if it's just living one life cycle, maybe with different stages? And that is the reason for the spontaneous recovery. And the other thing, why are there different lengths? And it can't be said it's always 4 weeks, maybe a person has 6 weeks. What if one of these stages where was intervening for the human body and stopped or diminished that one step, and that had an influence on the other one? And that was differently on what stage the attack of the immune system was on the virus as an outcome. Again, that was all speculation, but I think that is an interesting speculation. Cat scratch fever. Do we have it all together? Basically, we're going to start with that. The book from 1982 doesn't really know what it is, but it explains what is happening. There can be a scratch from the, what have we been called? From the nails of a cat or from a fawn. And then after a few days, a small blister filled with pus can follow there. And after 2 to 6 weeks, it can also get painful and swollen. The lymph glands which are draining the site can become inflamed, swollen, and sometimes have then a serious abscess. There can be increased temperature, headaches, chills, tiredness, general feeling of illness or ill health, and maybe a rash, hand and feet. 2 weeks to several months can it last. And if they have abscesses formed at the lymph glands, it can take a long period of convalescence of recovery. Could be a virus, it's not known. They can be drained, these pus things, was it in here? Yeah, maybe these abscesses can be drained. A normal doctor cannot really diagnose it. It's further made to a hospital where part of it is taken and then looked under the microscope at it, most of the time spontaneously within 4 weeks. Cat scratch fever. In this book from 1982, there's basically said that it's not completely known what it is. But here's said what they say. They say that it can happen after a cat had scratched someone or a fawn had scratched someone, and then after some time there are blisters with pus develop, and maybe after 2 weeks or something also is there then pain and swelling. And maybe even a rash at the hand and feet, and maybe even headache and slightly increase of temperature, chills, and a general feeling of ill health. And then it's said that a person should consult a doctor if there is such a blister with pus or something, and then a normal doctor is then said here cannot really diagnose it, so it's then referred to a hospital where is taken a piece of it and then looked under a microscope under it. That must be biopsy. And we don't know what it is here written, and it could be a virus is their idea what it might be. It can be a bit more serious when the lymph glands which are draining it can become inflamed as well, and they can even form an abscess. Then they might be drained also. And the recovery, if the lymph glands with abscesses were covered, then a longer time of convalescence, so a period of recovery, convale. A period of recovery can be necessary, but we're saying generally after 4 weeks it clears spontaneously up. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 110, written in the year 1982. But this is no substitute for medical knowledge and also no medical advice. And the positions and views expressed are the ones of the source and don't necessarily align with my own or the ones of the entities spoken of. That was the medical part. If you were here for medical medicine, you can go directly to the next part of medicine, or you can go to cytology or to osteology, where we're going to talk all about these other things. If you stay here and participate in the hip training, when it's with the owners, have your feet standing together, out with one foot and the other foot, heels and heels, toes, toes, heels and heels. And toes and heels and heels, and this time stay down in the knees. Up again. And legs a bit shoulder width apart, down into the knees, press them together, straighten one leg. Right it again. Our legs straighten it, and up. Legs to the sides, down into the knees, legs, press together, over to one side. Over to the other side, middle, closer together, rest to the outside. And one leg up, leg to the side, the reef in, middle, down, arm up, to the side, middle, and down. And have a good standing leg, one leg up, and press up and to the side. Other leg, press up to the side. And one leg to the side, lift it off the ground, place it again onto the ground. Other leg. And one hand on tummy, one on lower back, and lift one leg in a straight line up. Try to bring the leg higher, pull the toes in. And pull the leg up. Other leg. And leg up. And stand good on one leg. Turn over to the leg. Down into the knee. Over to the other side. Up again. Change the leg. Turn over. Down. Turn over again. And up. And one heel onto the ground. Lift the heel off the ground. Place it again onto the ground. Don't do it if you're pregnant. Other heel onto the ground, lift the heel off the ground, place it again onto the ground. And the seesaw airplane, arms to the sides, leg up. And bend the front leg up, again down. And the hiding airplane, knee in and out. And middle, and the other leg. And pull the knee in and out. And middle. Legs to the sides, put your finger down. Out. In and close the legs. And out. That was the hip training. I thank you very much. And next time.